Okay. Does anybody have any thoughts about what to focus on next? Because we have about 20 minutes now. Thoughts about what to focus on next? Any interest? So we talked about the cardiovascular system, the heart and the blood vessels, so that includes strokes, heart attacks, and so on and so forth. We talked about it last week. We touched a little bit on it today. Cancers, we talked about it last week. Touched a little bit on it today. We touched a little bit about the respiratory system. Ruth?
I wasn't here last one, but did you cover anything on the nervous system?
Well, that's
Hearing loss, shingles, or whatever. Yeah, cover that last time.
no, that's one. Okay, we talked about the brain. I talked about the brain being a part of the nervous system. That's what we've been talking about now. You're right. So what you're talking about more is like peripheral, not the brain now, but the extensions of the brain. So that's the nerves in the body, like that's what causes shingles, that affects the nerves in the body, the ear problems, eye problems, and all that. Do you want us to talk about that, or should we just touch on that? What area do you want to talk about?
Well, I'm sure hearing loss is quite common.
Yes. Super tough. Yeah.
That might give you eye problems. Eye problems.
Yeah.
I have seen a huge amount of shingles out here. And I went to have a colonoscopy, and this doctor there said, I had several cases of shingles on my body. I also had 6 bouts of shingles in my eye, just in the eyeball. He said, Jan, he said, you know what causes shingles, don't you, mostly? And we talked, I said, we also about the chicken pox, blah, blah, blah. He said, cortisone. You've been on a lot of cortisone for your autoimmune disease. And every time they went back over my records, every time I had a shot in my back, after I broke my back, I got shingles. So be careful with cortisone. There's a pill you can take that will keep you from getting shingles from cortisone. The doctors don't tell you that. And I flew down to Mexico, to Yuma 3 times. Nancy can attest to it, to get vitamin vitamin B shots in the stomach, and then he would take and squirt them on that shingles. I flew down here with a pillow wrapped on me, and he squirted that vitamin B complex, available drugstores in Mexico, 6 short syringes of them. The pain went away immediately, and I had been I had blisters all over. So there are natural, I'm not natural. Yeah, from the vitamin B complex. Now he said, don't just go to the hospital, this doctor down with you. He said, go to a compounding pharmacy and get B. My doctor gave me a shot of it, it helped a little bit, but then I got there. So I was down 3 times that winter. And that's the best thing for shingles. No, it's in a syringe. It's got a needle, and it's you can give yourself a shot right in the stomach. He gave me a shot, but you also can just squirt it on this syringe. Yes, don't do it on your favorite sheets, but it's fabulous. And I have bought it every year and gone back. Every time somebody gets shingles, they call me and say, you have any of the magic beans?
All right, so with shingles, if I may say this, shingles is, thank you for that, yeah. So shingles is actually an infection by a virus. Viruses are lot of flack these days. But these viruses take charge when the immune system is depressed. So cortisol depresses the immune system. So, which is another reason why you need to strengthen your immune system. So cortisol can do it, stress can do it. I have a friend who lost her husband to cancer, and she was so stressed and depressed. Later on, she had shingles, very painful. She also lost her daughter afterwards. Again, she had shingles. So it's due to a depression in the immune system. So you have all these viruses and bacteria that are already in our bodies, just waiting for the opportunity.
My problem is in hearing loss.
Yeah.
Hereditary, whatever. And most hearing loss, I guess, is.
Yeah, super tough. Super tough. I gotta say, super tough. Some of it, so same thing with eye problems as well. You can try. I honestly have not worked with hearing loss with seniors as much, but the basic principles are there. It's a nerve problem, yes. It's also an inner ear problem. So there are structures in the inner ear that may be faulty. I would say, so some of the testimonials in this book also talk about high dose of vitamin D for things like eye problems and ear problems and hearing loss. That's one aspect to go through, and something you're going to have to experiment with. Another thing is some of this hearing problems, like hormonal imbalances, including estrogen. As you grow older, estrogen levels tend to go down. You can have things like vertigo, tinnitus, hearing, buzzing sound in your ear, and all that. So there's also something you can do. There are supplements that help to regularize your hormonal levels.
Balance.
Excuse me.
Balance.
Yeah. So balance helps do that. So there are supplements that can help to regularize your hormonal levels. Probably have to experiment with that a little time. So I don't have a specific answer for you. Nerves are classically difficult to treat. That's the thing, classically. But like I said, higher doses experiment with things like atrial fibrillation, which is a nerve problem as well. So nerves of the heart. So ear problems, I tell you, I haven't figured that out yet.
Maybe something to work on, Doc.
Yes, I guess something to work on. Yeah.
Nobody has.
I know. I mean, it's even easier to address eye problems than it is ear problems. What I say. Yes, ma'am.
It's probably old.
I mean, yeah, but
I never knew where something.
I know, right?
I mean,
There's got to be a way to stop it. There are other things that we can stop. So, I mean, the problem I have with just saying old age is that it shuts you down from thinking of and figure out. It's kind of like saying that Black people, it's because of racism. Let's end up racism and that this discussion. Well, there are other things involved in that too. I mean, while they were saying, okay, when, as you know, Blacks had like twice as bad, four times as bad as COVID-19. Black people were dying 4 times as much as white people. And we're like, oh, it's just about racism. So, treat them well enough. That's idiotic. Other reasons for that. One of the reasons for that is vitamin D. Not having enough vitamin D levels. Now, after 2 years later, we found out that those who have the most severe forms of COVID-19 are those who have the worst levels of vitamin D system. So I always say this: would you rather have an overdose of vitamin D, or you will die from face the consequences of having COVID-19? I'm yet to read anywhere where high levels of vitamin D has killed anybody. You read anywhere where COVID-19 has killed anybody? I think the choice is pretty clear. All right, so there you go with that. Sorry, Ruth, don't have a really good answer for you there. Let's see. So let's see what else Let's talk a little bit about the respiratory system. So among the top causes of death, thank you, yeah, that's it. Top causes of death in seniors are pneumonia. The lungs just eventually give in because of all this exposure. We know that be a viral problem, could be a bacterial problem, could just be accumulation of dust and asbestos and all the other things that make the lungs less flexible, less viable over time. If you're a smoker, in a polluted environment for a long time, eventually the lungs run, instead of being nice and spongy and pliable, it becomes fibrotic, consolidated, therefore it's not allowing air to come into the body like it should. If you have a lot of allergies, if you live your life with allergies, there's a good chance that the passages, the airways that should allow air to come in are being occluded because of the mucus that has happened over time, that has been built up and solidified. The same thing with asthma. But from what we've seen, a lot of people tend to have problems with their lungs over time. And of course, the big one, the granddaddy of them all, lung cancer is still the one killer in when cancers are concerned. It's still the biggest cancer killer in the world. And close to 50% are really smokers. So that goes to tell you that it's not just about smoking. Not an excuse to smoke, but it's not just about smoking. So again, the theory is, by the way, the Nigerian government has officially given us permission, mandate, we have a mandate from the Nigerian government to teach about building strength. So it's not just about prevention, it's not about cure. It's about, I cannot emphasize this enough, it's about building strength. So once you understand these basic principles that we've been talking about, you can now apply them to the specific areas. So your questions, you are dealing with cardiovascular health, or you're dealing with arthritis or pain or whatever it is. What part of my body is affected? And what are the nutrients that part needs? Because it's not the same for every part. Now, there are some general things like we say, vitamin D, vitamin C, magnesium, take it a step further, start finding out what are the specific things in specific areas. By the way, Focus Plus has a lot of vitamin B in it, which is one of the reasons why it's so good for the brain. But some people are saying the reason it's called vitamin B, there are lots of vitamin B's, that it's usually called it vitamin B because B stands for the brain. B is for brain. So you can't really address nerve problems or brain problems without vitamin B. But the granddaddy of them all is what? So what is the first thing that should come to mind when treating or addressing the brain for our discussion? What is it? What's the number one nutrient you need for the brain? Yes, sir. Omega-3 fatty acids, high quality omega-3 fatty acids. All right, so let's look at the lung. Again, this is important because this is COVID-19. COVID-19 is here to stay. So you're going to have, so the health of your lungs, the health of your respiratory system is now going to be an ongoing concern. Never let up, never lose your guard. Always have to take something for your respiratory system. This is kind of like what it is. So from here, from here upwards is the upper respiratory system, and from there downwards is the lower respiratory system. Like I said, this should be very spongy, very pliable, so you can expand and contract. If COVID-19 escapes, gets through here, gets into the lungs, at the end of those air pipes, you have what are known as the alveoli, or the air, or the bags, air bags. And this is one of the alveoli. This is where the magic happens. So oxygen comes in through here. So again, this is the end right there, is the very tippy end, like the leaves. So if you think about it this way, the leaves of the tree, the leaves are what's taking carbon dioxide, and they do all the respiration and all that, and then they take in the energy and it flows from the leaves to the twigs to the branches and into the body. The tree needs leaves to live, because that's the leaves that bring in the carbon dioxide that it needs. And it's also the leaves that bring in the sunlight that it needs to be healthy. If you flip it, it's the alveoli, the air bags that need, that's, first of all, if it's out of the alveoli that the oxygen gets into the bloodstream. And it's from the bloodstream that the carbon dioxide gets back in. If anything happens here, this is a very, very delicate, this is like one cell layer thing, so it's very, very fine. If anything gets in the way here, this exchange will not happen. That's what happens in COVID-19. The virus triggers a response that causes inflammation, that causes the immune cells to go all crazy. They damage this lining here. So once this lining, this area is damaged, and once it happens in enough airbags, then you're going to have problems with breathing, and that's when your oxygen levels plunge, and therefore you need a ventilator. Okay? So what should we do? Just gotta strengthen the immune system. So I'm sorry, strengthen the respiratory system. I didn't have a diagram here, but so there are nutrients. The nutrients, all the nutrients we've been talking about, help to strengthen and protect these areas, not just these areas, but also the windpipe all the way to the sinuses. So that's where these nutrients all come in. Vitamin C, I mean, like we said before, vitamin C is, no matter what the question is, vitamin C, same thing with vitamin D. Vitamin C is what makes collagen, which is like the scaffolding for the human body. Collagen is what makes your bones strong. Collagen is what makes your eyes strong. It's what protects your brain. Doesn't matter your skin. Obviously, ladies, you know about this more than I do. Use your skin, as collagen goes down, skin becomes more wrinkles. Sorry, that's how it is, right? As collagen you have, the more wrinkles your skin is gonna be, and so on and so forth. So collagen is what helps to strengthen all the organs in the body. Vitamin D3, there's a lot of research now showing that vitamin D3 protects against upper respiratory tract infections. It protects the lining, those airways, because that's where the fight is, like I keep on emphasizing, that lining, where the air passes through, that inner lining. Same thing when I talk about the cardiovascular health. The arteries, that innermost lining of the arteries, that's where the magic is. You've got to protect it. You've got to protect it. That's why, and again, it's different nutrients, but again, it's vitamin D, vitamin C, and zinc are your starting points. But the immune cells also immune cells are very active in the sinuses and in that lining. So the stronger you make those immune cells, then these are the supplements that I need: vitamin C, vitamin D, zinc, vitamin A. Now, having said that, there are some people who are maybe already have been damaged or had lung damage from COVID-19, right? And some people who survive, but they've had COVID-19. They survived this, but they find it difficult to breathe. I know some younger people who now, when they go up the stairs, they're like exhausted, they're panting and all that. Before COVID-19, they never had that problem. So some people clearly have had damage to lungs, and therefore their lungs are not pliable and spongy like before. There are nutrients that can help to do that. In fact, it's funny, when I came here about 2 months ago, I was just thinking about it. I think I mentioned it to you, Jan, one morning. I said, you know what, I wish I had, yeah, somebody had complained about chest problems. I was like, no, I wish there was a supplement that could really help with lung problems. There should be, but I can't think of any at that time. Couldn't think of any supplement that would specifically help with the healing of the lungs. And then, lo and behold, later on that afternoon, somebody from the company whose products I use, among the companies whose products I use, tells me about this new lung product that they've discovered that works and they put together. And this guy, he had lung problems with COVID-19. He's used it, albeit acid doses, but he got significant improvement on it. So, point being that even if things have gotten past the prevention stage when there's actually damage, there are things that can be have supplements that specifically target the lung to help with the healing of the lungs. Just have to figure out something that can actually heal the ears as well. That help with hearing problems. Maybe I should call them and say, hey, what's your next project going to be? I know a good one. Let's work on the ears. Right, Ruth? So, okay. So there we go, usually the respiratory system. And like I said, it's going to be an ongoing duty of yours. Always protect your respiratory system. All right, we talked about the gut. I'm hearing from the grapevine that gut problems, colon cancer, stomach cancer is going to be on the rise the next few years. It's going to more than double colon cancer. Anybody will imagine why? Why is colon cancer becoming such a problem? Yeah, exactly. Diet, chemicals, a lot of things that we're eating are just not good. And the more we use technology to, process foods, and the more we figure out how better to get the most out of the least, the more things are going to suffer when it comes to healthy eating and healthy food. But when I was in Minnesota, one of Leslie's grandson, when we went on the boat trip together, he deals with forestry, he deals with agriculture, planting trees and all that. He's telling me about all these different variations, genetic manipulations, hybrids they can do to breed for quality in terms of greener, taller, more bushy trees and all that. So I'm thinking about what he's saying all this. So how about the quality of the fruits themselves, right? Are the nutrients still going to, how much of nutrients? Well, we don't really think about that. We're just looking at what sells, right? Taller trees, the bushier, one looks good. And that's true. It's like nobody's concerned about the nutrients in the food that you're eating. You didn't get this right. Nobody is concerned about this. I don't think they are. They're not. So you've got to start taking these matters into your hands. Like I said before, one of it, we don't do all this in Nigeria, we don't do all this big tests. So one of the things that can make, I'm going to show a picture. Is it okay? Poop picture? Okay. Okay. Don't say I didn't warn you. So you want to have at least twice a day. Twice a day. That's how we know your gut is working. If you're not pooping twice a day, even if you're eating okay, it's just once a day. Maybe it's a genetic problem, maybe it's a genetic thing, maybe that's how you are because your parents are like that, you grandparents were. Can't tell you. Most people, and I know this is a problem with ladies more than with guys. Ladies tend not to go to the restroom for whatever reason. Maybe it's not cool. I don't know. But they don't, this is what we say. Ladies just tend not to go to the bathroom. And of course, as you grow older, the muscles in your digestive system aren't working like they should. So, it's work. Those muscles have to contract and expand and contract and expand and push that stuff down. And with age, that strength reduces. So it's natural you don't poop as much. Okay? I'm telling you now that that's not a good thing. So if you can do something to correct that. So I mentioned enzymes, I mentioned probiotics, and I mentioned fiber. We're going to look at what the Bristol chart is. You've got to feel that you've pooped. And once you've pooped, you're like, ah. You know what I'm talking about, right, Bob? You get the idea. It's not that you take a newspaper into the bathroom and read the front on the whole newspaper and then you're still not done, right? And they just go and get it done and then get out. That's what a good poop is like. Start spending 30 minutes and all that, that's the problem. So here's what is known as this is a general thing everybody talks about. It's called the Bristol, the different kinds of poop that you should have. people have, so we kind of categorize it. You don't want it to be watery. You don't want it to be fluffy, little spots. So these, I think it's 3 and 4 that are ideally, right? So the word is S-shaped. It's kind of complicated. All joined together and becomes an S shape because it kind of like, when it hits the surface of the water, it kind of like, I don't want to use the word ice cream because I don't want to. Oh no, I'm going to. I'll do it. Ah. Oh. Somebody would never look at an ice cream the same way again.
You know why turds have points on them, right?
Huh?
You know why our turds have points?
A point, no why.
That way our butt cheeks don't slam shut. I know, it was a crappy joke. It's getting worse. I'll try to clean up my act.
I gotta think about that for a while. All right, so what strengthens, so basically, we said, again, what strengthens the gut? What makes the gut healthy? You're not be able to do all the tests that you need to do, but now that you are aware, you gotta start doing something about it. Vitamin D helps too. In fact, they find out vitamin D helps with, it helps to feed the good bacteria. So the good bacteria need vitamin D. They also need vitamin B as well. Well, the big guns are you gotta have microbiotics. I know somebody here was having difficulty with constipation, always very tough, even the right kind of enzymes, not as much. He's not having as much problems. I'm not saying it solves the problem completely, but it helps. So if you're eating fermented foods, and then there's also another supplement too that has all these fermented foods out at home. I take it every day myself. Again, this is a company with seafoods. He actually saw us on Facebook. I reached out to him, and he's like willing to gives us a discount to Nigeria. It's called Fermented Essentials. Has all they have it all pre-fermented for you. And it's put in the powder form, so it's freeze dried and it's well preserved. So all you need is a powder. So kind of like the same thing I do with Focus Plus. I just take a powder, put it with my fiber, add some vitamin C. Sometimes at night, sometimes during the day, and I just drink it like that. That helps keep my digestive system healthy. The advantage I know so many of these people, and I know where the best ones are, and I get it cheap. So I can do all this. Pretty much everything I've talked to you about today, I take on a regular basis. Pretty much everything. Okay. Okay, maybe not bone broth because I'm sometimes. Well, bone broth is super good. It has a lot of amino acids and nutrients, and it acts as a balm. Settles your stomach, heals. I'm still looking for a supplement that I can use. That's kind of like, you know how you use a nice skin supplement where it's kind of like you had some scars or you have super sensitive skin. It's like a balm. It's neutral. It doesn't cause any further irritation. Still looking for a supplement like that I can use on my gut. I can use for gut issues. I know aloe vera leaf can have that because they've been using it for years. But they use aloe vera leaf gel for burns, skin burns on the surface. Similarly, too, they can use on the gut as well. Yeah, so like this meal that Dan and Nancy has. It's made from the aloe vera leaf. So it does help with the gut as well. But it's a capsule. Yes, ma'am.
Dr. Dave, I think it's the Nigerian diet that upsets the stomach.
Really? I wouldn't know. I have no idea what you're talking about. And I've been pretty well on my diet. All right, so I have this picture here that basically kind of like gives you an overview of things that affect your gut. Sorry, the microbes. So those bugs, it's like a colony, it's like an ecosystem, it's a universe within your gut. And so many things affect it, from your emotional health to your activity levels to exposure to sunlight to your sleep. Antibiotics can be terrible, especially for younger kids. And there's a lot of abuse of antibiotics, especially in the US. Every small thing for kids, especially for kids, please, your grandkids and so on. You don't want a 2-year-old or 3-year-old to be taking a lot of antibiotics. You want to absolutely minimize it. One of the reasons for that is that the antibiotics wipe out the bacteria in the guts. I said, wipe them out, destroy everything. And what happens when you wipe out all the vegetation in the garden? You leave it for a while, you go back. What happens? What do you see? Weeds. Exactly. The exact thing that you do not want. Well, the same thing, the same way when you use antibiotics in your kid, especially kids, because their brains are not developed as they should. Wipes out all the good bugs and the bad bugs, yes. What grows in their place? Weeds, bad bugs. I don't know what it is, folks, but it's so easy for the bad stuff to grow and not so easy for the good stuff to grow. I've seen kids with autism. I treat kids with autism who were perfectly okay, but maybe they had a recurrent ear infection or they had gut problems. And the doctor just hammers that kid. I had a kid for a whole year, hammered antibiotics. At the end of the day, came up with autism.
Are you familiar with celiac cell?
Yes, Clostridium is the cell, yes.
And then the tons of antibiotics.
Was it vancomycin? What did they give you?
Okay. It started with sinus problems. We gave me all these antibiotics for something. And you know.
Did you get set so you can see your life so that you help, right?
Yeah. I had
Good. It's killed. It's one of the most difficult infections to treat. Clostridium, so that's the best. Extremely difficult to treat. Robotics can help that. Yes, ma'am.
Antibiotics, we think of taking pill form antibiotics. If we eat chicken breast, if we don't watch where we're buying it, that's the chickens are fed antibiotics and the breast is where it goes to. So it's a breast meat you can eat. Beef, all of this meat that we're consuming, if we're not buying good meat that hasn't been injected with all of these antibiotics and stuff, we're getting more antibiotics there than we are, most of us.
Right. That's a good point. Very, very good point. Yes. We're getting them either way. Yes. So all the more important it is when you take probiotics and take fiber to feed those probiotics. Okay. So again, because I deal a lot with kids, I see all these problems. If you don't breastfeed your kid, are you giving formula feeds? Again, black people, big problem. Don't give formula. Give formula feeds are not like breast milk. Breast milk has certain nutrients in it that only human breast milk can provide. One of the most important nutrients that human breast milk has is this right here. It's manna. One of the reasons why it's so important, and that's what we're using for our research of sickle cell disease. The other thing that human breast milk has the highest levels of omega-3 fatty acids for the growing child's brain. So super important. It also has the different nutrients that can feed the good bacteria in the gut. So it's very, very important. And of course, if you have a vaginal delivery as opposed to a cesarean section, they found out that vaginal deliveries are better because as the child is passing through, the probiotics from the mother's vagina and gut enter into the child and helps to seed his guts. It's more beneficial than the CS because it doesn't get seeded in the same way. You heard this before? You haven't heard this before. So vaginal normal deliveries, they tend to have fewer amounts of autism and asthma and the other conditions that are related to having a poor microbiome. So diversity from the vagina helps the bodies from the vagina helping the diversity of good bugs and bad bugs. So the gut microbiome is related to diabetes, it's related to obesity. Even with regards to drugs, they found out that the way you metabolize drugs, the same drugs, somebody your age, your background, your genes, they metabolize it entirely differently, because based on the kind of bugs that are in your guts. So a lot of it's an exploding field. You don't need to know about that. What you do need to know is that you're putting this stuff and sure off in your guts, so that's it's a healthy ecosystem. Like I said, diversity is king. Diversity, I mean, everybody's talking about diversity and inclusion now, especially important in the guts. What we know is that as you grow older, that diversity begins to lessen. You have fewer and fewer of the different kinds of bugs. And you have more similar bugs. Okay, I just wanted to probably, almost done. Okay, so I'm just going to round up by saying this. The same, I want to talk about the teeth. You probably know about this already. But the same doctor who talked about vitamin C, has written another book called, it has to do with the teeth and your dental health. And he is finding out, the cardiologist, is finding out that over 75% of the infections and the problems that are going on in your body could be related to problems in the teeth and in the gums. So if you don't have good dentition, you have gum disease, you have fillings, you have silver fillings. As a matter of fact, toxins, so silver filling, aluminum, things aluminum, they have these fillings. Found out that the more you chew, the more those things break down and get into the bloodstream, in fact, to get to the brain, cause toxicity, that will make you more prone to having dementia and Alzheimer's disease. So it's really important that you are concerned that you know what you're putting in your mouth. You ask your dentist, it says silver fillings. You don't want silver fillings. They have alternatives now. I think that's actually an archaic way to treat the teeth. But here we have it. So we have the teeth are unhealthy. You're more likely to have heart disease, strokes, cancers. In fact, look at breast cancer, especially if pointed to some specific teeth, gums that are affected by diabetes. I had a doctor on one of my shows. He said, if your teeth aren't healthy, your blood sugar control is it's going to be warped. It's going to be negatively affected if your teeth aren't healthy. But those bugs are going to confound, they're going to distort your body's ability to regulate blood sugars and cholesterol and so on. So you need to have healthy teeth. I mean, in Nigeria, it's not, I say this, most people didn't know that. In the US, thankfully, you all know about it. You gotta brush your teeth twice a day. If you're gonna brush your teeth only once, when is the best time to brush your teeth? If you had a choice of brushing your teeth once a day, when is the best time? And bedtime. Exactly. Why? Your teeth and your gums. It's going to fester, the microbes are going to work on it, it's going to put into all this kind of bad stuff. And that's for 8 hours, probably nice. So you want to brush your teeth at night, you want to floss, because you don't want, they say up to 40% of the surface of the teeth is actually unreachable by a toothbrush. So you need to floss as much as possible. Okay. Let's see. So just to wrap up, these are the laws of life. Essentially, I'm just talking about what you put in your mouth, but you all know about all these other things. The reason you're alive today is because you consciously or unconsciously practice these things. So, yeah, talk about oral health, sleep quality, relationships very important. Sitting, don't want to be sitting. That's another thing they're finding out. Sit down for a long time at a table or a desk. Not lie down, but sit down for a long time. and you don't move around, it makes you more prone to cardiovascular disease. There's something about that position that's blood flow is not is affected, and there's a greater trigger in that area for clotting, cardiovascular disease. So, and they said that cannot be reversed. It cannot be reversed by exercise. So if you exercise 5 times a week in the gym for an hour every time a week, 5 times a week, and yet you have a job which you sit down for 8 hours straight, you're still at a high risk of certain diseases because you sit down in that position for good.
We have a chiropractor that said one of the worst things for your health is the recliners. He said, get one of those old fashioned wooden rocking chairs. That's really good. But the recliners is really bad.
Interesting. That's because for the back problems, right?
Yeah.
Did not know that. I did not know that. Interesting. Okay, let me just so us. I think we covered. Thank you, Laura. Let's see if there's anything else. Talk about the reason why. So I did mention that for cancer, you got it. CDZ, the big three. If you're concerned about cancer, I definitely would recommend immune. Some people have to take large amounts of immune because immune specifically strengthens the most important cell in your immune system. That's the macrophage. The macrophage is like the Tom Brady. Too bad he lost, but he's like the Tom Brady. You're clearly not fat. Okay. So anyway, he's like the quarterback. Macrophage is the most important cell. Macrophage needs ACE mannan. Show this picture here. So this ACE mannan is not a green thing that activates the macrophage to find cancer cells, to fight viruses, to fight bacteria. Okay. So I just want to just make sure that so this is the last time we should cover everything. Okay, I did mention that nitric oxide is very important. Your body produces nitric oxide. As you get older, it doesn't produce enough. What nitric oxide does is that it relaxes the blood vessels so that it allows blood to pass like it should. If you don't have enough nitric oxide in your body, blood vessels are tight, and therefore do not allow blood flow. Most people, if not all people who have a heart attack or a stroke have really, really low levels of nitric oxide. The thing that helps produce nitric oxide in your body is a supplement, the protein called, amino acid called L-arginine. We'll talk about that once. We'll talk about that tomorrow, Tracy. L-arginine, the body breaks down L-arginine and produces nitric oxide. And that helps with blood flow. This is a picture of a blood vessel. You can see it gets blocked. Number one thing, nitric oxide is produced by the inner lining of these blood vessels. This inner lining is healthy, it will produce nitric oxide, and therefore deal with all this plaque. But unfortunately, most people don't have enough nitric oxide, therefore the plaques form. They have as much as 70% blockage, as you can see here. Supposed to get, have as much as 70% blockage, you won't feel a thing. That's 30%, you just get blocked, just like that. Okay. Remember the white of rice mentality. Go after it, attack it. I'm blessed you not to have this trade. This trade probably about $10. But I think for $10 a month, probably are covered. Now these are a little bit more expensive. This one is not. Make sure you have it. For heaven's sake, make sure you have it.
So that nano silver.
Yeah.
That comes in a bottle. So and you pour it in the little spray bottle. Where do you?
You take it, tables, the recommendation, I think it's 2 teaspoons a day. But I say throw away the recommendations, especially if you're, like I said, when you feel you're under attack, under threats, you might want to chug some down, because in a bottle of spray to keep spraying throughout the day, anytime you think about it. But the recommendation is 2 teaspoons or 2 tablespoons. Sure. Does that answer the question?
Yeah.
Let us go ahead and just answer the question without not hearing. Okay, this is the main thing I want to take away from this. Your body is under attack. Your body is under threat every single day. It's your responsibility to make sure that you're providing it with the tools and the resources it needs to protect itself. Okay. And again, show these pictures, Ministry of Health. And again, when you say it again, if you feel your heart, to donate, checks are made to Brain and Body Foundation, or our work with sickle cell disease in Nigeria, or you can use technology and just send a text to 44321, type in SCD in the body of the message. What we're trying to avoid this girl. She's probably like 20. They look very young, but they are old. But because their bodies are just being broken down all the time. Okay. That's the end class. Okay, all right, that's about it. Just wait.
Have you heard anything about sitting in the sun, and closing your eyes, and in 6 minutes, you get all the vitamin D that you want?
You're sitting in the sun and closing your eyes.
Yeah, so your eyelids are in the sun.
Okay. I have not heard that.
6 minutes.
I doubt it if that's true for everybody. Certainly not.
Certainly not with white guys.
Certainly not for black people. Yeah, maybe it was not white people, but certainly not for black.
I want to thank David for coming. We've got 10 more minutes. There's only 10 pages on the test that you're going to have today. And so if you need a pen to fill out the test, that would be great.